Here's why your sciatica is not going away. Sciatica is a condition caused by an irritation, inflammation, pinching, or compression of your sciatic nerve. It can lead to moderate to severe pain and weakness in your lower back, buttocks, and legs. Sciatica typically heals in 4 to 6 weeks, but for some people, it can last longer. In this video, we look at potential reasons why your sciatica pain is sticking around. Here are some reasons why your sciatica may be getting worse. First reason might be injuries. If an injury was responsible for your sciatica, and if your symptoms get better and then worse, you may have re-aggravated the injury that originally caused your sciatica. Sudden injury and repetitive overuse injuries can lead to sciatic symptoms. Herniated discs are the most common cause of sciatica. Age and underlying health conditions may be a factor. In general, younger people heal more quickly than older people, but there are many underlying health conditions that can also slow your body's ability to heal. Some conditions include high blood pressure, obesity, diabetes, heart disease, malnutrition, and smoking. Infections can also aggravate symptoms of sciatica. An epidural abscess is a collection of pus that develops between the bones of your spine and membrane of the spinal cord. It can lead to swelling that puts pressure on your nerves and may even lead to sciatica. Usual wear and tear may also play a role in the development of sciatica. Wear and tear along your spine can lead to a condition called spinal stenosis, which is narrowing of the spaces within the spine. This narrowing can compress your nerve and lead to sciatica. Lifestyle can also play a role in the development of sciatica. Sciatica often responds to gentle exercise. It's thought that mobilizing the sciatic nerve may help improve symptoms by decreasing nerve sensitivity. Gentle stretching and exercising can be recommended as part of a treatment. It's important to note that a sedentary lifestyle, one without a lot of physical activity, can potentially aggravate symptoms of sciatica. Here are some tips for what to do if your symptoms are only getting worse. You may find relief from sciatica using certain home remedies, but you should see a health professional to diagnose you with sciatica first. If you haven't already tried treating your symptoms at home, here are some tips that may be helpful to you. Cold. Try applying an ice pack or cold compress to the painful area for about 20 to 30 minutes, several times a day. Heat. You can apply hot packs or heating pads to the sore area for 15 or 20 minutes, several times a day after the first couple of days to stimulate blood flow to the injured area. NSAIDs. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, are drugs such as aspirin or ibuprofen. They can help you manage pain, swelling, and even inflammation. Physical therapy, stretching, and exercise. A physical therapist can help you strengthen weak muscles and stretch tight muscles that may be contributing to your pain. It is recommended to resume normal activities and gentle exercise as soon as possible. See your primary care physician. If you've tried home remedies and have been unsuccessful in making your pain go away, it's probably a good idea to talk to your health professional. Your physician can prescribe muscle relaxers, stronger painkillers, or other medications. In certain cases, your doctor may recommend epidural steroid medications. These medications are usually injected around your spinal cord in order to help reduce inflammation. And in some cases, surgery may be the best option. This includes instances of worsening pain, pain that hasn't improved with other treatments, and severe weakness in muscles that results in a loss of bladder or bowel control. One option is a microdiscectomy, a minimally invasive surgery that offers quick relief of symptoms. The procedure removes the disc material that's putting pressure on your sciatic nerve. A laminectomy may also be considered, which is a surgery that involves removing bone to ease pressure on the spinal cord. How long does sciatica usually last? Well, sciatica can last anywhere from 4 to 6 weeks. About 30% of people still have symptoms after a year. It's not always clear why some people develop chronic sciatica and others don't. A sedentary lifestyle, along with improper lifting techniques, can be a major risk factor for chronic sciatica. Risk factors for recurrent herniated disc include diabetes, smoking, and disc protrusions. Here are some tips to prevent the recurrent sciatica. Making certain lifestyle changes can help you prevent sciatica symptoms. Lifestyle changes such as eating a balanced diet and exercising regularly, minimizing sitting and sitting with good posture. Avoid bending your back when lifting heavy objects, and choose exercises that are unlikely to cause lower back injuries. Avoid smoking, minimize your chances of falling by wearing sturdy shoes and keeping the floors of your house free from clutter. Here's the bottom line. Most of the time, sciatic pain goes away given enough time. It's usually best to see a medical professional at the first sign of symptoms to develop a treatment plan. Some people have pain that may last longer than average. To prevent recurrent sciatica, try to not bend your back while lifting. It's also a good idea to apply the tips we discussed earlier. If you have severe pain, your pain is getting progressively worse, or if you notice anything else that's concerning, it's usually wise to discuss this with your health professional. I'm Dr. Cedric. Thank you for watching.